Stay next to the sheriff. He's got a dog.
There's good right there. Good afternoon. We're here this afternoon to talk about the unfortunate passing away of a little Bergen County resident from Little Ferry. You all got the information from the Commissioner of Health, a 69-year-old male that resided in Little Ferry. As I said the other day, I hoped that we would not face this day, but today has come. And as I had said the other day, we are continuing to be prepared to address this virus as it continues to spread across the country, the state, and this county. To the family, the County of Bergen expresses its deepest sympathy. Know that all of Bergen County is saying prayers to your family. While we will mourn the passing of the Little Ferry resident, we will now move towards mitigation, as I had said yesterday at the press conference in Ewing. I was hoping that a death would not occur here in Bergen County and that we would be able to work on having those things in place. But we're going to now move forward with putting mitigating steps in place to limit the spread of COVID-19 here in Bergen County to the best of our ability. So let me say at this point that I now have signed Executive Order number 2020-01, pursuant to the authority vested in me under the County Executive Form of Optional County Charter Law, NJSA 40:41A-36 and 37, and Article 3, Section 3.4 of the Administrative Code of the County of Bergen, I issue the following executive order. Whereas on January 30th, 2020, the World Health Organization designated the novel coronavirus COVID-19 outbreak as a public health emergency of international concern, and whereas on January 31st, 2020, the United States Health and Human Service Secretary declared a public health emergency for the entire United States to aid the nation's healthcare community in responding to the coronavirus COVID-19. And whereas the spread of COVID-19 within New Jersey constitutes an imminent public health hazard and threatens and presently endangers the health, safety, and welfare of the residents of one or more municipalities or counties in the state. And whereas, as of this date, 15 presumptive positive cases of both travel-related cases and community contact transmissions of COVID-19 have been documented in New Jersey, with confirmed cases in Bergen County. And whereas the spread of COVID-19 in New Jersey at a rate comparable to the rate spread in other affected areas would greatly strain the resources and capabilities of county and municipal governments, including public health agencies, which provide essential services for containing and mitigating the spread of contagious diseases such as COVID-19. And whereas on March 9th, 2020, the governor of the state of New Jersey has declared the concurrent invocation of both a state of emergency pursuant to NJSA A:933 and the public health emergency as contemplated by NJSA 26:13-1, which action invokes the authority and powers contemplated in NJSA 26:13-3, the Emergency Health Powers Act. Whereas on this date, March 10th, 2020, the state of New Jersey recorded its first death attributed to COVID-19, and accordingly, the county will implement more aggressive mitigation measures in conjunction with the current containment efforts to combat COVID-19. Whereas the county is working with federal, state, and local officials and authorities on a daily basis on the prevention and mitigation activities, and including providing critical information to the public about COVID-19 to provide facts and avoid unnecessary fear, training emergency responders and health professionals about the disease, and investigating suspected, presumptive, and confirmed cases. And whereas Bergen County provides the service of health officers to 35 of the 70 municipalities that comprise the county, whereas the Center for Disease Control has determined that COVID-19 generally presents a low risk to children, but seniors, particularly those with underlying chronic medical conditions, are at high risk of serious illness from the disease. Whereas one of Bergen County's priorities as part of the county's preparedness and response planning is to get critical services to those areas where the most vulnerable populations are located and provide vital resources for those support and care of vulnerable populations prior to, during, and following an emergency. Whereas the county may be required to acquire goods and services that may not be currently available in the county product inventory or from vendors with whom the county currently has contractual relationships in order to protect and maintain the health, safety, and welfare of New Jersey residents and visitors and successfully combat the impact of the virus. Now, therefore, I, James J. Tedesco, County Executive of Bergen, do hereby order and direct that the above recitals are incorporated herein as if more fully set forth at length. The health emergency hereby exists within Bergen County regarding COVID-19. All necessary county agencies are authorized to take appropriate action to assist municipal governments in containing, preparing for, responding to, and recovering from this COVID-19 outbreak. All county departments and agencies immediately shall implement any and all infectious disease guidelines and protocols and use all personal protective equipment in connection therewith. All county departments and agencies shall provide all necessary assistance to federal, state, and local authorities to protect the health and welfare and safety of the citizens of Bergen County during the COVID-19 outbreak, and shall prioritize the most vulnerable county residents served and develop the appropriate contingency plans to avoid any disruptions of service, with a special focus on senior centers and our Meals on Wheels recipients. All county employees shall follow all local, county, state, and federal health recommendations, in addition to Center for Disease Control recommendations, including but not limited to hand washing, sanitizing, and basic infection control procedures. There is an immediate ban on all county business relating to international travel or domestic travel to any states that have reported COVID-19 cases. Similar travel restrictions are strongly recommended for all county businesses. In order to protect those who may be more susceptible to COVID-19, their family and loved ones, visitation at the Bergen County Healthcare Center in Rockley, New Jersey, is now hereby suspended until further notice. The facility is hereby directed to review alternative technology means to provide visitation to residents. Similar measures are strongly recommended at the many long-term care and senior-focused facilities throughout the county. Bergen County residents who are seniors, particularly those with underlying health conditions, are strongly encouraged to avoid large crowds and large gatherings while COVID-19 remains a threat. To combat COVID-19, the county shall be permitted, wherever necessary, to procure the necessary goods and services which are not available under contracts currently in existence with the county, without complying with New Jersey public contracts law, including but not limited to the following: to award emergency contracts, including but not limited to emergency contracts or leases for relocation and support of county operations, for professional services, for purchase of commodities, services, and technology, the purchase of food, supplies, services, and equipment, to procure any supplies or equipment required to ensure adequate sanitation, cleaning, or sterilization of any facility or location. The county health officer shall implement an emergency regulations or amendments to any sanitary health codes of the 35 municipalities in which services are provided by the county health officer, and recommended same to the remaining 35 municipalities. The county health officer shall engage in periodic and regular communication with all local health officers in order to coordinate activities, avoid any gaps in information sharing, and collaborate on containment and mitigation measures in order to ensure accurate and comprehensive contact tracing to effectively combat the spread of COVID-19. Coordinate, communicate, and collaborate with all local health officials to take the necessary steps to combat the spread of COVID-19. The county agency shall take all reasonable measures to protect the health and safety of such vulnerable at-risk population, including the safe treatment, transfer, and discharge practices, and to comply with the Emergency Medical Treatment and Active Labor Act, 42 U.S.C. Section 1395 DD, and any associated regulations. The county health officer and all departments and divisions shall work collaboratively to determine and execute efficient strategies and initiatives, protocols, and procedures to prevent, mitigate, and combat the spread of COVID-19, particularly among the most vulnerable and at-risk population, including but not limited to senior centers and nursing homes, and take all action to the extent necessary to maintain the public health with respect to the treatment or containment of persons with or possibly exposed to COVID-19. I strongly encourage the cooperation of all local health officials with the county health officer to share information to the degree and extent possible and permitted in order to effectively combat the spread of COVID-19. This order shall take effect immediately and shall remain in effect until such time as is deemed by me that the emergency no longer exists. A copy of this executive order shall be immediately transmitted to the Bergen County Board of Chosen Freeholders, and I thank the members of the Bergen County Board of Freeholders for being here today with us. Now, actions that have already taken place. As I said, the Bergen County Health Care Center in Rockley will now prohibit visitation. Bergen Newbridge Medical Center, effective immediately, will prohibit all visitation to its long-term care facility. That is approximately 570 beds. Today, in consultation with the president of Bergen Community College, we've extended the closing of Bergen Community College through next week. Bergen Community College is closed this week for spring break, and it will remain closed next week. Effective tomorrow morning, all Bergen County special services and technical schools will remain closed. That is approximately 3,500 students and about 1,600 staff members. Why are we doing Bergen County special services and technical schools? That school system takes students from all 70 municipalities throughout the county and 4 counties in northern New Jersey. So in order for us to, again, mitigate, control the spread, we are going to close the Bergen County Special School and Bergen County Technical Schools and all associated programs with them, effective tomorrow. Dr. Lerner is here along with Superintendent DiLessio, and that recommendation came through the Bergen County Health Department along with my office. It's been communicated to the Assistant Commissioner of Education, and Dr. Lerner's staff is right now putting in plan their place to have people educated at home. Those are the things that we are doing immediately. Things that will evolve over the next few days are looking at going to our senior centers throughout the county, talking to the senior population, recommending that those seniors that have the criteria for the highest exposures not come to the senior centers for their best interest and the interest of the people that come to the senior centers. Those that have come there for meals, we are going to make arrangements for them to get meals delivered to their home. In regards to our county workforce, we will be rolling out a program where we are going to look at trying to work with our workforce in regards to who the most vulnerable population is. We know the criteria for that. We're going to work with our department heads to identify those that potentially could be most vulnerable. So as action needs to be taken, we are already prepared to take that action based on having that information. As I said almost now 2 weeks ago, we're going to be prepared. We're going to take the necessary steps to protect the largest county in the state of New Jersey, 1 million people, larger than 6 states in the nation, because this is the right thing to do. As I said to everybody yesterday in the press conference, we're from New Jersey. We're tough, we're strong, we're resilient, and we'll get through this. But we need to take steps in order to get through this. And these are just the first steps that we're taking here in Bergen County to make sure that we minimize the risks of the spread of this disease to the people of Bergen County. I'd like to ask the health officer, Hansel Asmar, to come. Hansel, you just give a quick update on the numbers that we have right now, or have they not changed since this morning? They haven't changed since this morning, so you all know them. Dr. Lerner, you have a statement you want to read?
If I can, thank you, County Executive. Just to clarify, I want people to know that there are no cases of COVID-19 currently in our schools. We are trying to mitigate the spread of this disease, as the County Executive indicated. And just as a clarification, we are closing schools starting tomorrow for all students through next week. We'll be reevaluating. Our teachers are expected to come to school tomorrow and Thursday to complete all of the lesson planning and home instruction that we will be providing to the students. Our schools right now for our staff are safe. We can have our staff work with their computers and get our virtual learning ready. And again, there are no cases currently in our schools.
Thank you, Dr. Lerner. Next, I have the president of Bergen Community College with me, Dr. Tony Ross. Mr. President.
Good afternoon. Working in collaboration with with Bergen County Executive Tedesco, Bergen Community College has decided to take the proactive measure of extending spring break by 1 week in an effort to prevent the transmission of COVID-19 on campus. We don't have any cases and we don't expect any, but certainly this is a preventive measure. Just as scheduled this week, the college will remain open, but all classes are canceled. That means our staff will report as usual, but no classes will be held. At this time, we expect classes will resume on Monday, the 23rd of March. However, that does remain fluid, and we'll be continuing to work with the county and to take our direction from them as we go forward. During this week and next week, college leaders will continue to develop academic and business continuity plans to ensure continuation of the academic schedule in the event cancellations extend beyond March 23rd. The college will continue to communicate with students, faculty, and staff as guidance and protocols evolve. We appreciate your patience as we, the world, and the county navigate this public health concern. Thank you.
Thank you, Mr. President. As I said earlier, Little Ferry was the community in which the gentleman passed away. And with me is the mayor of Little Ferry, Mauro Raguzio, and Charlie Sarlo, the accounts, Tom Sarlo, I'm sorry, Tom. I'm going to ask the mayor to address you about his community and provide just a few remarks. He will not take any questions. I will take the questions, not the mayor. Mayor?
Thank you, County Executive. Today is a very sad day for our community in Little Ferry. First, our thoughts and prayers for the deceased individual and their family members. I received a call early this afternoon to come to meet with the County Executive, where he shared the information that the person had deceased, that there was a person who had tested positive for the virus and deceased this morning. We are going to get through this. I want the residents of Little Ferry to know that I will share with you any information that I have that I can share with you as soon as possible. Right now, we don't have any facts. An investigation is starting. We just know that it was a 69-year-old male and that he died this morning. We are going to do everything we can working with our partners in the county, and let me just thank County Executive Tedesco and the Board of Chosen Freeholders and the entire county for all their help in the last couple of weeks preparing municipalities and school districts for this type of scenario. Last week, we convened. I'm here with, as the County Executive said, I'm here with Councilman Tom Sarlo, who is also the OEM Director in Little Ferry. Last week, we convened the OEM board to go over precautions that we need to take and how we would deal with a situation like this. Obviously, no one wanted this day to come, but it is here, and we're going to get through this. My community is a tough community. We are a resilient town, and while this may be shocking and this may be frightening to the residents of Little Ferry, I'm telling you, we're going to get through this. Let's work together. Let's not panic. Let's take all the precautions necessary, as we've been doing for the last couple of weeks. Let's limit the amount of contact we have in terms of where our hands are on our faces and so forth. You just common sense. That's what we need to do. Not panic, but common sense. And I promise you, as soon as I get information that we can share with you as to this individual, we will share that with you and what happened and any travel or anything that, that this individual experienced prior to him being deceased. Again, our thoughts and prayers are with him and his family. It is a sad day, but we will get through this. We are a tough town. We are a tough town. We're prepared. We'll get through this. Let's all work together. Thank you again, Mr. County Executive, for your leadership. We wouldn't be prepared if it weren't for you and your team. Thank you.
Just a little bit about what's happening. So Little Ferry is one of the towns that the county is the health officer in. The surveillance and the contacts and the whereabouts of where the individual went has just started. We only became aware of the positive test when the Department of Health notified us, and you all heard that right when we did, or we heard a few minutes before. But that was when we found out that the person tested positive. Understanding that the protocol is that you don't do anything until you get a positive notification. So until we got that positive notification, there was no other surveillance being done on this individual or any other individual that we're waiting for test results on. That is the protocol. Once we were notified, our health department, under the direction of Director Asmar, started to put in place the surveillance. That is in conjunction with the Department of Health, and they are now putting the plan in place to do the contact survey and the surveillance of the individual. So those of you that want information or are going to ask me about information about the person, we don't have that. And the reason I'm saying that is because it's just starting. I don't have any information out of the hospital. You all probably have more information out of the hospital than I do. I don't have information out of the hospital. So I won't be able to talk to you or answer any questions in regards to the person specific. We just don't have that information. As the mayor said, and as you all know, I've told you from the beginning, the information that I could share with you, I absolutely will share with you. I've given my word to the mayor that as soon as we find information out that we're able to communicate to him and his community, we will do that. Again, this is a very unfortunate day for us here in Bergen County because one of our family in Bergen County passed away. As soon as we get information, we will divulge that information. We will provide that information to those that need it. And I want everyone to know that we're going to do everything in our power to minimize the chance for this to happen again. We want people to recover from this disease. We want people not to get this disease. And so we're going to do everything we can. And I will take more steps if they're needed to ensure that we can do everything we can to protect the safety and health of the people of Bergen County. At this time, I'll take some questions.
Have any county officials started the interviews yet with the little ferryman's family?
No, we just started the contact base. We just started the contact investigation now.
Real succinct.
We just started the contact investigation with the hospital and the state health department collecting data, and then we're going forward with the other more personal information about the individual.
So yes, to your question, yes, it has started.
So when did you find out he had COVID, and then how long after that did it expire?
We received the report on our system on March 7th.
We received we received a pending. He was a pending test, and today, at the same time, we received that he passed away and that it was a positive. So we received it today. All happened all at the same time.
Yep.
So he was pending in our system this morning as a pending test.
Jim, can you please clarify, was the closure on the schools just the county-operated schools, or are we talking about all elementary, high schools in Bergen County?
Bergen County Special Services, Bergen County Technical Schools, just Bergen County-based schools. The reason being is because we take students in from all 70 communities in Bergen County and 4 counties. So it's,
Englewood and kind of.
those are individual municipal school districts that are not covered by this.
How about the little ferry schools at this point?
At this point in time, we have no information to make a decision to close them based on the information we don't have from the survey. So the little ferry schools, I believe, will stay open, Mayor, until more information comes available.
Will you, once you get the information about where this guy may have been leading up to this, will you be telling us?
To the degree that I can share that information with the public, I will do that, yes. Anyone else?
There's another Bergen County case, right? Do you have any information on that?
So that was the one that was announced this morning. I don't have any more updated information on that person. Teaneck is not covered by us from a health standpoint, so I don't have any detailed information about that other than what the health commissioner gave me earlier today, that's all.
Guys, how long does it take to do that surveillance? I mean, are we talking 24, 48, 72? What's it like the timeline?
Well, it depends on what type of travel history he had, where he's been. It could take a day, it could take 2 days, it could take 3 days. Because sometimes you have to, if the individual was very active, then there's more people that you would have to follow and contact and make sure that everyone that you're talking to, they understand that they could have possibly been exposed, and then you have quarantine measures and all sorts of measures that have to go into place. So that's why you have to have coordination with the state health department and our local officials to make sure that we gather as much and the families, as much information as possible. He could have not traveled at all. He could have stayed home for the past month. If that's the case, then it's very easy to do. But if he was very active and was in many different places, and we have to follow, because the thing is you have to start with the closest contacts and expand from there. Because you don't want to be testing the guy he said hi to, 10 days ago. You want to start with the immediate family, friends, if he attended a party that weekend, especially within the last 14 days before he went to the hospital. So you want to make sure that you do a thorough investigation, and that we check, we cross our T's and dot our I's. So we don't want to miss anyone. We want to make sure that we're prudent about it, and that we also respect people's privacy. There are HIPAA requirements here. You can't be just throwing out people's names and stuff like that. We have to be very cognizant of that, and we respect people's privacy. But at the same time, as the county executive said, it is a public health issue, so we want to make sure that we're all working together. This is a team effort. It's not an easy thing to do, especially in light of what's going on. But I could assure you that we will do everything in our power to get this done and do it right. That's one thing that I stress on my team, that we have to have excellence in everything that we do, and this one is a top priority. Thank you.
Do you know how many of his family members and friends you've spoken to already?
I can't comment on that, I'm sorry.
Again, I'm just telling you that literally just within the last couple hours, this all just started to move forward, because again, until we knew that it was a positive result, we weren't in that process.
Does that mean maybe in the future, if you have a pending, you might take some steps at that point, or is that just impossible?
I'm not the health commissioner. That's controlled by the health commissioner. And that, I would certainly love for you to ask that question to the health commissioner.
Has the CDC confirmed any of the test results that were?
That would come through the state. Go ahead, Brian.
Was it exhaustion, or did I hear something else in your voices cracking a little bit while you were reading that emergency declaration?
Brian, it's something that I hope that I didn't have to do. That, I had to do it. I knew that we were prepared to do this. I knew that we were ready to do this. I was hoping we didn't have to do it. Certainly the speed in which we're doing it, while we're prepared to do it, this is a fluid situation. And so I'm, 2 weeks ago when I held the press conference with all of you, I told you that we were preparing. We'd prepare for the worst and hope for the best. Today, unfortunately, is that we've lost a family member of Bergen County. And for that, I'm emotional. And I'm also understanding that the responsibility we have as elected officials is to understand that, be able to be compassionate, but we got to protect the 999,999 other people here in Bergen County. And so that's what you see us doing here today, Brian, doing that. Anyone else?
Jim, I just want to say thank you for your transparency to the public. It's much needed at a time like this, and your leadership is phenomenal. And I think it's great that you could give as much information as possible and still be as concerned as you are. But as a freeholder, I appreciate it, but I'm sure the public appreciates even more how you kept everybody informed along the way. And obviously, this is difficult for you knowing how emotional you are. So thank you
Thank you, Freeholder. We will provide updates as information becomes available. To the extent that the information I want to get out to all of you, we'll either put out a press release and/or we'll do another follow-up press conference with additional details. As the situation changes here in Bergen County and it becomes more fluid, and again, this is something that, you know, I don't want to mislead people. I said this 2 weeks ago. We expect to have more positive cases. Make no mistake about that. But the planning that we're putting in place is designed to help protect those most vulnerable right away, and then to address the rest of our population. So as things change, we'll continue to get out in front. We'll continue to get you the information that we can provide to you. Thank you. Come on.